Welcome back. Thank you for staying with us. And on health, today we are discussing something quite prevalent in our society today, migraines. Dr. Kuti is in the house. He's a certified medical practitioner who's worked in both the private and public sector. It's great to have you. You are welcome. Migraine, that's something that a number of people talk about, and some people, I feel like people make it seem so common. Okay, I have a headache. If it's heavier than normal, they call it a migraine and all of that. Let's start with maybe some sort of a definition. What exactly is a migraine? How can you identify a migraine headache?
Okay, thank you for having me. So, first of all, I need to correct it. Not all headaches are migraine.
Not all, it can be.
Not all
yeah.
So migraine has its own characteristics. So the first thing first is usually one-sided of the head. We call it unilateral. So it's just one side of the head that you're having the pain. Common behind the eyes or above the eyes. So you feel much of the pain behind or above the eyes. Is usually made worse with lights or sound.
Photosensitivity.
Yeah, photosensitivity. And lastly, you can associate nausea and vomiting if it's that severe. So those characteristics are significant to migraine.
With migraines,
yes.
Right? Okay, so which set of people or what kind of people are most susceptible to migraine headaches?
Okay, so for children, less than 12 years, males are more susceptible than females. But above that age and in adults, females are more susceptible. There have been hormonal issues associated with that. So when females start menstruating, estrogen being produced has been associated with causing migraine. So for adult females, or when a female starts menstruating, they are predisposed to having migraine more than the males.
Is there any data to know the percentage of females in that particular stage who have or who will be susceptible to having a migraine?
Well, data in our own environment, no.
No, okay, no, forget our environment. Just
yeah,
let's talk global.
In the foreign world, yes, there are data to.
So, but what do you think? How many percentage of females would have a migraine when they are menstruating?
Well, the last survey done is like 1 in 5 females.
Oh wow, that's like 20%.
Yes, will have a migraine.
Will have a migraine
once in their life.
Okay, so now let's talk about curative measures and maybe preventive measures.
Okay. Before I even go to that, I would like people to know that there are 2 types of migraine.
Okay, all right, let's talk about
There's
that.
a migraine associated with an aura, and there's a migraine not associated with an aura. So when I mean aura means like symptoms you feel before the actual pain. That precedes it. So for some people, they know when they are about to have the migraine. So they have these symptoms. Some of them, like I said, they feel nauseated, they want to vomit. Mostly they have visual changes.
So you know it's coming.
Yes, a sparkling light in their eyes or a blind spot. They can't see well before the migraine starts. And that is usually not common, it's about 20%. So the one without the aura is the one that is more common. So in managing migraine, there are 2 types. Are you trying to abort the migraine or you are trying to prevent it? There are different medications for it. So if you are trying to abort the migraine.
That means before it comes, you have already taken something to...
We want to prevent it.
You want to prevent it?
Yes, yes.
Okay.
But if you're trying to abort it, there are medications, there are pain medications. The common one, NSAIDs, that we all use can be used. Yeah. And there are other ones, which I don't want to mention. But there are also medications that you can be used to abort the migraine. The migraine. However, if you want to prevent it, the first thing first, for people that know their triggers. So triggers for migraine can be stress, can be change in sleep pattern, and like I said, people that are menstruating, even some food, chocolate, cheese, sugary things can trigger migraine. So if you want to prevent it, you have to avoid those things first of all. Then you have also medications that are prescribed to you. So once you feel the aura or once you're undergoing stress or you are going through those things that might predispose you to having migraine, then you take those medications.
Now, what we've heard so much about, how dangerous is a migraine if left untreated? What is the worst that could happen?
Well, migraine can be mild to very severe.
Yeah.
So for people that they don't treat their migraine, they can have even as bad as what we call neurological deficit. So it can mimic like a stroke. So they have paralysis of one side of the body,
that's what I was going
weakness. Yeah, so it can mimic a stroke. So people will think that they have a stroke, but meanwhile, it's just a migraine.
It's just a migraine.
But you have to be very careful, especially as the medical practitioner, because you want to make sure that it's actually migraine, not stroke. So because they can mimic each other, they can
The symptoms can
be very similar. So that's like the worst you can have. Then there's also the one we call the basilar migraine. That's the one that affects the back of the head. That can also affect balance.
Okay.
You can affect your vision. It can affect the way you walk. Affect. Yes.
I have.
It can be very serious.
Yeah, there's some conscious. Some people I know that have it constantly. I mean, there's some people that it's almost every night. You know, they are battling with it. Some people can't sleep and all of that. In those particular kind of scenarios, I know you spoke about, you know, some people don't actually know that maybe what they eat and what they do at different times can cause this. Someone who's battling migraines regularly, what kind of person watch out for? How can you ensure that maybe you keep yourself in the best possible condition so that you can, you know, maybe prevent it or something? Okay. What can they do? People that have it regularly.
So first thing first, once you have it regularly, you have to know, is it hereditary? Is it something within your family? Like, because here, migraine can be hereditary. So you have to identify that fact. You have to identify your triggering factors.
We mentioned that the hereditary. You know that hereditary can be very... with the rate of the DNA thing as it's going now, you know, I don't know if it's very, very, you know, ensuring that your family line is actually your family line, but
I don't want to go into where
that coming from.
So yeah, you have to know that you have to identify the trigger factor. Most times there's always a trigger factor. So if you are someone that has migraine regularly, you have to identify your triggering factors. And if you can identify it's good, you avoid those triggering factors. And for some people that you can't identify the trigger factors, then you have to start your medication. That's the preventive medications.
Preventive, abortive medication.
So you want to prevent it, you have to stick with your medications. There are various types of medications, so you need to see your doctor, and you have to be in close contact with your doctor because sometimes you might not get it once, even as the health practitioner, you might not get the right treatment once. So you might try this, it doesn't work. So there are classes of drugs that can be used until you get the right one that can work for the person.
All right, find it now. Can migraines be a precursor to something much deeper or something bigger within the human system? Like, is it possible that it could be a precursor to a bigger ailment or something?
Well, to a bigger ailment, not really. Okay. Like I said, migraine is just its own.
It's kind of like a standalone.
Yes, it's a standalone. It's not like when you have migraine. But if you don't treat it properly, you can
develop into something.
Yeah, like I said, the neurological symptom of paralysis.
Much bigger. Paralysis, is that really that is possible?
Yes,
with a migraine.
With migraine, yes, it's that bad. Some people have it that bad.
Wow.
And it can make you miss work for a very long time.
Wow.
I've had people talk about migraine and they say they feel like they should cut off their heads. Like it's that severe. So it's something that it's common and very important to know about it and to manage. You have to understand how to manage it to know, okay, is it actually migraine I have or not? And if it's migraine, how do I manage this thing?
How do you manage all
So
of
people
that?
like with migraine, you advise them to sleep in a very quiet place that is dark, you understand? That can also help them. You don't want to predispose yourself to unnecessary light and noise.
All right, thank you. This was quite an enlightening discussion. I'm definitely sure it's going to be on YouTube. People can check it out and get some pointers on how to prevent and treat migraine. Thank you very much, Dr. Kuti.
You're welcome.
It was great having you. All right, that's it. I hope you've been able to pick one or two things there. We'll just take this time out now. We'll be back with you.